So very good afternoon, and we request all the delegates to be get seated. Without wasting my time, we'll be now going to the prestigious presidential oration of GSI, and this will be delivered by this will be delivered by our national president, Dr. Sajesh Asokan, and the patron of Geriatric Society, Dr. O.P. Sharma Sara, will preside this.
Before I say over to you, Sajesh, just 1 second, I will like to remember his father, Dr. Asokan, with whom I had a lot of interaction right in the beginning. And Dr. O.P. Sharma has many times praised him. And this is my turn to salute him, to have this kind of illustrious son. Sajesh, mic is yours. Get them the feel of your goodness.
Thank you, sir. Thank you, everybody. And again, it's a postless lunch session. I guess everybody is just relaxing, and we are just going to start something on a little different tack. Now, as you know, when we were on the beginning of organizing this conference, we started from scratch, practically from scratch. Everybody had their doubts, and we wanted to start from where a theme would be made. So during one of the meetings which we had, one of the themes which we decided was the theme of the WHO, that is the decade of healthy aging. And during one of the scientific committee meetings, I remember Dr. Gino asked me, Dr. Gino is our geriatrician friend from Medical Trust Hospital, what is the theme of the conference? And suddenly my mind went blank. What to think? We had already decided, but we are not getting it. Then we all got together and decided that the theme would be based on the WHO theme, that is the decade of healthy aging, innovations and paradigms. Now, when I put the whole concept together from the beginning stage, now there was a involvement at a very early phase of us from different segments of our geriatric community. We put the entire platform in place with the cooperation, with a spirit of cooperation, you can say, of the entire geriatric community. Those who are all involved in geriatric care, they are here, they are represented here. The idea is to put forth to society what we can do for them as the Geriatric Society of India. So this is the concept that we had. And the word that came forth for me at least, is the word Salutogenesis, providing quality care for our beloved seniors. Now, is this a new term? No, it's not a new term. It's a term that was coined by a medical sociologist in the late 1970s called Aaron Antonowski. And it is a term in health science to indicate an approach to wellness, focusing on factors that support human health and not on disease. That is, we don't focus on the causes of disease. We focus on the wellness aspect. So the term comes from the Latin word salus, meaning health, and the Greek word genesis, that means origin. So there you have Latin, Greek put together, you have Salutogenesis. It refers to the study of origins of factors that promote health and well-being as opposed to focusing solely on the causes of disease, that is pathogenesis. In many of our conferences today, we are very much focused on the pathophysiology, on the clinical presentations, on the treatment part, whereas in the case of geriatric medicine or geriatric care, it doesn't restrict itself with that. It has a whole spectrum. So we have specialists, we have people working in community medicine who are involved in geriatrics. We have geriatricians at one end of the spectrum, that is hospitalist. We have physicians, family physicians, general practitioners, and we also have occupational therapists, physiotherapists, social workers, community workers, all those people. And then we knew that we had to bring this together onto a platform. So the entire conference is also planned in that way. And then we had the WHO. Actually, Dr. Cancel was there with us just a few minutes back. She has to go to the airport. So Dr. Cancel and the WHO actually, the concept of age-friendly cities. My good friend Praveen Pai is in the audience, and Kochi was declared as the first age-friendly city in Southeast Asia. So we had to move this concept forward. So as doctors, as geriatricians, as physicians, whatever specialty you are, even if you are from nursing or allied specialty, we had to get the entire organization together involved. So that's where we took it forward. So it emphasizes the study of resources, behaviors, environments that contribute to a person's ability to cope with stress and maintain health. With the increasing tendency of global aging and the progression of healthy aging, salutogenesis has been adopted as a framework of health promotion for older adults and is a valuable concept to be kept in mind while interacting with the older adult. So, while there's a comprehensive geriatric assessment which we do for initial assessment of the older adult, and there are various factors involved in it. We heard talks today from various speakers, including Dr. Shiba Nainan, yesterday from Dr. Biju Raghavan. So many ways about how we should interact with our patients, especially of the senior citizen category. We also know that what Dr. Biju Raghavan said yesterday, don't take them for granted. Don't think they are fools, and for God's sake, don't be condescending towards them, because they, whatever be their educational background, they have much more wisdom than all of us. So it's a health promoting orientation and sense of coherence. This SOC, I will be mentioning just as SOC, it's a sense of coherence. It's a vital coping factor associated with quality of life and self-efficacy. Salutogenic based interventions showed potential in improving health outcomes. I'm just briefly mentioning a few studies. So, of which one of them was a integrative review, and which came out in one nursing journal. 8 studies, 1 qualitative and 7 cross-sectional quantitative studies from Western countries were included in that review. In general, a strong sense of coherence among older people was correlated with better physical, social, and mental health. So here we have a sense of coherence, which is a vital coping factor associated with quality of life, QOL. And we are generally aware that better physical, social, and mental health is always associated with longer lifespan. The use of generalized resistance resources such as appraisal, coping strategies, and social support was correlated with a sense of coherence and perceived holistic health and quality of life. So the study concluded that in communities where older people have access to general resistant resources are more likely to have a stronger sense of coherence, relatively good health, and an acceptable quality of life. Now, further, the intervention studies show address how older people can develop and employ generalized resistance resources. That is, in your day to day practice, if you encourage the patients daily, motivate them whenever they come for visits, motivate them regarding the general health guidelines, which you all have heard all through this conference and before that, you will understand that each time you intervene during one of those sessions, you are improving the quality of life. And this includes interaction with the family members. Remember, for the elderly, family members are a vital part of the treatment. So, in a meta-analysis also, salutogenic based interventions in older adults on SOC showed significant effects favoring salutogenic based using the empowering self-management model or strength resource-based approaches. However, for their studies, it was not consistent across studies. So, in practice, it is applied in fields like public health, education, psychology, gerontology, and designing health promoting environments, green spaces in cities. It encourages behaviors that enhance resilience, such as physical activity and social connections. So, I believe my good friend and our executive member, Dr. Praveen Pai, so he's very much involved in promotion of age-friendly cities concept. And we were doing community-based interventions, community-based talks. Yesterday, Dr. Arora and Dr. O.P. Sharma were also part of those interactions. Though most of it was in Malayalam, they kept nodding their heads. Hopefully, they've understood something. And then, of course, they did put their viewpoint forward. In essence, salutogenesis shifts the focus from what makes people sick to what enables people to stay healthy to become healthier. This positive resource-oriented approach can be applied across various life stages and settings. So what you do is you develop interventions that foster a sense of purpose and meaning to life. Yesterday again we heard Dr. Biju is there behind telling about patients who speak a lot of things negatively to you and where you have to intervene and then change the tack or change the way that you deal with those patients. So, how does it relate to healthy living? So, it highlights the importance of resources. Internal example, you give optimism, a sense of coherence, and external. External means social support. Family support would be social support. Access to healthcare that help individuals navigate challenges associated with aging. For older adults, building resilience through meaningful relationship, lifelong learning, and physical activity can counteract the negative effects of aging. One another important aspect, see, we have kept a lift here. This lift is for people with difficulty to get onto the stage. This is fully conceptualized, designed, and created by a man sitting there, Dr. Praveen Pai. Dr. Praveen? Yeah. So this is especially because we have Dr. Navneet Vada also who's giving a talk. Now we started thinking how to get this man on stage. And Dr. Praveen Pai came out with this wonderful idea of building this lift. It's a lift. We can even take a person up on that. So that is what he has done. I don't know, with some agencies, some engineers, he's worked that out. So this is though it's a temporary structure, but this is what. Now, as you came into this IMA building, I hope all of you have realized some things. We are all doctors sitting here. I'm not criticizing anybody here, but as you come inside the rooms, go inside around, little bit more age-friendly, disability-friendly things are required. For instance, what we usually recommend to our patients in the toilets, if you go to any other grab bars, handle bars, support bars, many things, anti-slip mattresses, whatever, you name it. There are things here which all of us are probably seeing, but we are not discerning enough to point it out. We are all seeing this. We are all going about, all of us are doctors here who are working in geriatrics or involved in geriatric care, but things around us, why are we keeping silent? Why are we not speaking out, telling this is what the management needs to do, this is what they need to make more friendly? Look at your toilets. What do you have there? In the bath areas, do you have a grab bath? Near the shower, do you have some seat there for them? No. Many things are there which are missing. So even as you go through society, when you go around, look around. Are there ramps there? Those buildings, are they age friendly? So once you start developing in your mind this concept, everywhere that you go, so this is how you will promote. Otherwise, you will stick to a dull clinical practice. You will yawn as your patients talk. You will be thinking, how can you get this patient out of your hands? How can you get him out of the door? This is where you think. So from that thought process, all of us needs to change. So for older adults, building resilience through meaningful relationship, you're part of that meaningful relation. Lifelong learning and physical activity can counteract the negative effects of aging. Now, a core concept is the sense of coherence, which I said earlier, is a person's ability to perceive life as comprehensible, as meaningful. That is very important. You should have some meaning in life to move forward, manageable. After some years, you can see, abhi kya baki hai? Mujhe chhod do. Leave me alone. Malayalam may say, Doctor Nyanini Pote, Madiyai. Means I had enough. I don't want to move forward. I've lived my life. So, I'll come to that again. Aging populations with a strong SOC are likely to maintain mental well-being and manage chronic conditions, adapt to life changes such as retirement or loss of loved ones. My timer here is not working. I'm not sure what time is left also. Okay, so preventive and proactive health approach. So this approach contrasts with traditional biomedical models that focus primarily on treating illness and disability in aging. So rather than viewing aging as a period of inevitable decline, salutogenesis emphasizes the potential for growth, learning, maintaining purpose. So interventions inspired by salutogenic principles, creating age-friendly communities, fostering intergenerational connections, can improve older adults and quality of life. This intergenerational connection is very important. We need to get the younger generation into our halls here. We need to get them, we need to train them. That's why we have workshops here. That's why tomorrow we have PG programs. So we need to get these people in so that they will also have knowledge, have understanding. Even from their MBBS days, from their basic training days, they have to have this in mind. So you have to get these programs across to them. Wellness programs, elder-friendly environments, and most importantly, post-pandemic, combat loneliness. So what do we have? Practical examples. Community gardens. You encourage more physical activity. Most of it now, we are all becoming concrete jungles. We don't have space for people to walk. We don't have community gardens for people to sit and talk and chat with each other. Mindfulness and stress management programs. Lifelong education and hobbies. These are all very important. So in summary, applying a salutogenic framework to aging fosters holistic, resource-oriented approach to help individuals age healthfully, maintain independence, and achieve a high quality of life. In certain countries like Japan and the Nordic nations, they leverage salutogenesis to enhance life satisfaction. If you look at the elderly population, they have always some purpose, even towards the end of life. And that has better outcomes. And dementia care, In dementia care, it emphasizes creating manageable, meaningful routines that reduce confusion and anxiety. So, social isolation, combating it is very important. Social support is very important. And now you have digital platforms that can also create virtual communities for those who face mobility challenges, leveraging technology to maintain connections. So, chronic disease management is only one part of this. Remember, we are all doing chronic disease management. That is only one part of this. So, again, like I said earlier, it creates age-friendly environment, age-friendly cities. So that concept has to be ingrained, inbuilt even to our policy makers. And we approach this with active lifestyles and social ignorance. Now, points to ponder, Bill Gates, the billionaire Bill Gates made a convincing argument for why improving human health is money well spent. I have nothing to do with Bill Gates and won't lead to overpopulation in his 2018 video. Does saving more lives lead to overpopulation? No, it doesn't. So if we were told, if we are to stop all deaths, every single one around the globe right now, we would add about 1.5 lakhs people to our planet each day. That would be about 55 million people each year. You think that that's a huge amount, but that might sound like a lot, but it would be less than a single percentage point. So in spite of all the advances we have made in modern medicine over the last 400 years, the age of an elderly human has not significantly increased beyond 100 years. How much can you go? How many people live beyond 100 years? How many live beyond 80? So we have come across that. And that is why we have the concept of adding life to years. You heard Paulo sir mentioning that. Adding life to years rather than years to life. So this is the UN Decade of Healthy Aging. And what we have here is our theme, Innovations in Paradigms. And this is what we have done in our GSICON 2024 Kochi. Thank you.
Excellent philosophical presidential oration, which tickles our mind that let's think over it something, rather than something which is given in textbooks. Excellent, Sajesh. For you, I still remember those two lines, which I heard somewhere. अगर देखना चाहते हो मेरी उड़ान को, if you want to see how much I can fly, अगर देखना चाहते हो मेरी उड़ान को तो जरा और ऊंचा कर लो अपने आसमान को. You can really touch the sky. Hats off to you. Thank you so much.
Yeah, I think it's a wonderful oration and new ideas given. Frankly speaking, I belong to the TB and respiratory specialty. I was also thinking salutogenesis for the tubercle patients. Now, it's a common terminology, which you can use from day-to-day basis. And I'm glad that I learned a new word today. Thanks, Dr. Sajesh. And thank you to everybody who is sitting here. Let us salute him and make our mind clear that we are to go back from this room with an idea to have a salutogenesis for not only geriatric but all other diseases which they require. And particularly aging is not a disease, it's a physiological process. And therefore, it's another way to look at how we can help our elderly. Thank you, Sajesh, for a wonderful oration.
I request Honorary General Secretary of GSI, Dr. O.P. Sharma, to award Dr. Sajesh Ashokan the memento and certificate. Thank you, sir, for the presidential oration.